Primary care physicians know the patients better than anybody else. The only people that know the patients better are their family. The patients really do trust me. And I think over the years, that's been probably the most important medicine I have for patients, is building that trust. The reason I would refer to Tufts Medical Center is that I want to make sure my patients are taken care of as I would take care of them, as I have taken care of them. And Tufts provides that kind of collaborative care where they respect my referrals, they respect me as a primary care independent physician. They take care of the problem at hand and they send the patient back. A common thing that we have here in the community is colon polyps. And sometimes those polyps are difficult to remove because they're either large or they're flat and sort of pasted up against the lining of the colon. Dr. Hedgej at Tufts Medical Center is quite adept at removing these very difficult polyps. Prior to somebody like him, these patients would be operated on and a segment of their colon would be removed. Now, quite routinely, we send those patients into Dr. Hedgej. He sees them very quickly, and he is able to, through his expertise, remove those with an endoscope and prevent an operation. I had one patient who had a large cancer in his esophagus, and I sent him into Tufts, and he saw Dr. Dan Weiner. And Dr. Weiner evaluated the situation, felt that the patient needed to have the tumor shrunk before it could be operated on. To do that, you would need chemo and radiation. So Dr. Weiner went ahead and promoted the community specialists in my area to do those procedures and even helped arrange for the patient to come back. And the patient ended up having chemotherapy here in town by a local oncologist and then radiation therapy by our radiation oncologist here. The tumor shrunk nicely. The patient went back to Tufts and had the surgery, and it's been 2 years and he's been doing very well. I do trust Tufts Medical Center based on the experience I've had with them and the outcomes that I've seen, the quality of care that I've witnessed, and how my patients have told me how satisfied they are. So I trust them with my patients without a second thought.